Oh, hi. I just would like to ask why the travel restrictions are not a provincial order, and what would have been different if you had gone that route in terms of checking to make sure people aren't traveling inappropriately or having some mechanism to sort of stop and make sure that they are following the rules.
Yeah, it's exactly that. I don't believe that we need to do that. We have a lot of essential travel that comes back and forth. We get a lot of our essential goods that come here on the island by ferry, back and forth through the United States and other parts of Canada. So to step up that infrastructure and to have some mechanism to do that is very challenging. But we also know that when we had these same requirements in place earlier this year, that people took them to heart. We're talking about recreational and social travel, and it's very challenging sometimes to be able to understand. And I know I've started to get concerns from people again that they're seeing Alberta license plates and U.S. license plates, and it really is about remembering that we don't always know people's stories, and there are many reasons why somebody may be coming. They may have been here for a number of months now, we know that. They may have a need to check on a family member. So there's many different ways that we understand essential travel, and we trust people to take the right actions now because we are all being affected by this.
Do you have a follow-up, Rob?
Sure, thanks. Could I get a sense from you what kind of metrics you'll be using to determine if these restrictions are successful over the next 2 weeks? Is it daily case counts, or how much of a percentage decrease do you want to see in certain areas to be able to know that this is the circuit breaker method that you've been talking about?
Yeah, so we watch a lot of things. Certainly daily case counts are part of it, and our rolling average, because the day-to-day variation can reflect a number of things. So we are watching that very carefully. We're watching our ability to find people quickly, and that has been challenged, particularly in the Lower Mainland health authorities, where we have had so many cases per day. It's been a challenge for us to find people, to find their contacts in a safe and quick way, in a timely way. So we're watching that. We're watching a very important metric that helps us understand if we're holding on in public health, which is the percentage of people where we cannot link them to a known case or a cluster, and being able to follow up and stop clusters before they grow into larger outbreaks. And so we're at the brink with that, and that is the area that I'm most concerned about. And we initially, that was in the Lower Mainland health authorities, and that's why we put the restrictions on there to start. But as you have seen, there are things that we are learning about this virus, that it can spread more easily, that people's trajectories of how they move from place to place are not always linear, and that means we can get wide transmission before we recognize it. So we need to put these in place across the province now, and we'll be watching that. We'll be watching the spillover piece into where people are getting infected and where they're going. So we now are seeing, as you know, long-term care outbreaks and acute care facilities outbreaks. So yes, those are important. We have seen a decrease in the number of people who have been infected from attending social gatherings. So it is making a difference in the Lower Mainland. We've started to see that decrease. Now we need to focus on some of the workplace settings where we're seeing increases, and long-term care where we're seeing increases. So it is a balance. There's a whole bunch of things that we look at and agonize about every day, but those are the basic ones.